Definition: mental illness refers collectively to all diagnosable mental disorders and its characteristics be sustained abnormal alteration in the thinking, mood, or behavior associated with distress and impaired function. Mental illness is an important public health problem, but in its own right, and because the condition is associated with other chronic diseases and their resulting morbidity and mortality.
So there's a broad range of childhood behavior disorders, and the factors that cause these things come from many different sources. Some of the symptoms of childhood behavior disorders range from very subtle to very significant and very obvious to parents, teachers, and siblings. Some of the causes of childhood behavior disorders include things like medical or congenital difficulties, learning disabilities, developmental delays. Oftentimes, and more often than not, I see children that are simply just reacting to something that's difficult or stressing in their environment. When we think about some of the causes of all of these things, the etiology is not clear, but one thing that's certain is that if you suspect that your child is having some type of unusual or atypical pattern of behavior, you want to look for things like difficulties with changes in their day-to-day behavior patterns, such as difficulty sleeping or sleeping too much, increased negative reactions to small situations, moodiness, irritability, grouchiness. Your child may be being withdrawn, isolating, changes in grades, even situations where your child changes their friends that they have or some of the social events that they attend. So when you start to notice these symptoms, it's imperative that you contact a clinical professional. All of these behaviors together could mean that there is a clinical disorder.
Application in the nursing introduces to the person, explain to the ruling of each member of the therapeutic team, obtain the person perception of her problem and the objectives. He intends of his hospitalization or person, treatment, facilitation the free expression of feelings, determining the person needs and problem the behavior. Set the limits on unacceptable behavior or possibly the reform healthy behaviors.
Hi, my name is Dr. George Forgan-Smith and I'm a GP working in Melbourne's CBD at Era Health. We know that within Australia, mental illness is quite common. Approximately 1 in 4 people will suffer from either depression or anxiety or one of its forms at some time in their life. For this reason, the Australian government has created an initiative called Better Outcomes in Mental Health. This enables people to be able to see a psychologist at a rate that is subsidised by the government. It's quite easy for this to be accessed, and the way to do that is to first book an appointment with your GP. The paperwork takes about half an hour, so it's best to make sure you book a double appointment. During that appointment, the doctor will speak with you about what's been happening for you. We'll help brainstorm a couple of ideas that you would really like to focus in on, as well as doing a few tools such as a simple questionnaire to help work out where exactly you are on the spectrum of anxiety or perhaps depression. This is a fantastic scheme and many people have been able to access it. You can get up to 10 sessions with a psychologist or even with a GP who is trained in these initiatives. If you would like to learn a little bit more about this, please book an appointment with our people at the front desk and we'll be able to talk to you about what options are available for you. To book an appointment, all you have to do is give us a quick call. The number here is 03 9944 6200. That again, 0399446200. I hope we can help you very soon.
Pros. Early diagnosis and treatment is the only way to summon prevent the more serious symptoms of the childhood the schizophrenia. The treatment consists of taking specific antipsychotic medication as will the psychology treating the for the child and his family. What they will also have to learn what they did with this condition of the child, especially the when there is aggressive. Cons. Children with the language delay, hallucination like the voice to the imagining that did not really exist, dilation and the belief that are not real, lack of emotion or the inappropriate emotion according to the moment, isolation from other children. Issue a play in Ecuador. According to the World Health Organization, about a quarter of adults in Ecuador have a mental illness. Children with a parent who has a mental illness are affected by schizophrenia, bipolar disorder, or recurrent depression. The risk of death in the children having the disorder that affect their father is the 50 to 20 a time that of children without affecting a parent. And it has been cleaned up for decades that the 15% of the tended secret disorder developed during the childhood of adolescents.
Childhood schizophrenia or early onset schizophrenia is very difficult to diagnose in children. However, the course of symptoms is very similar to that of adults. What we observe in children with early onset schizophrenia are hallucinations, delusional or paranoid thoughts, and unusual or erratic behaviors. This is called psychosis. Childhood early onset schizophrenia is typically diagnosed by a child psychiatrist or pediatric neurologist. It's very difficult to treat. Behavior therapies and medications are often the first trials of interventions, but prognostically, they really just control the symptoms. There's no cure for childhood schizophrenia, but with family intervention and strong family involvement, a child with schizophrenia can go on to maintain a positive and prosperous life. Schizophrenia is very complex, but these are some of the specific factors underlying this disorder.
Conclusion. In my opinion, the mental illness that are detected in the children are being genetic inherited of the which is a serious mental disorder is a schizophrenia, which indication loss of contact with reality and disorganization of separatory, or a permanent disintegration of the personality.
I'm Jeannie C, and I'm here to speak with you about the question, what are a baby's chances of inheriting schizophrenia? The general population risk of schizophrenia is about 1%. So, 1 in 100 babies is going to develop schizophrenia. But if you have a first-degree relative with schizophrenia, so your mother, father, brother, or sister, then your risk goes up to 10%, so it's 10 times more. But it's still a small percentage chance that it will occur. If you have an identical twin who has schizophrenia, so you share all the same genes, then your risk is 50%. So it's not 100%. There are environmental factors that determine whether you will have it or not, even though you have the same genes as your twin. But if you have a non-identical twin, it's the same as having a sibling, so it's back to 10%. If you have one parent who has schizophrenia, again, the risk is 10%. But if both of your parents have schizophrenia, you would think that the risk would be very high. It's higher, but it's still only 40%. So 4 times more likely if both parents have schizophrenia. Among relatives of people who have schizophrenia, there's a 5 times increased risk of what we call schizophrenia spectrum disorders. And so that might include, sometimes having a paranoid delusion, but not the full-blown picture of schizophrenia, or, maybe hearing voices once in a while, but again, being able to function better than the average person that has schizophrenia. And so if you're a baby and you have family members who have schizophrenia, you do have an increased risk, but the risk is still low.